Hey everyone, welcome to this explainer. Today, we're diving right into the foundational curriculum of Orthodontics I, Etiology of Malocclusion and Dentofacial Deformities. Now, I know a lot of folks hear the word orthodontics and instantly picture rubber bands, metal braces, and just trying to get that picture-perfect yearbook smile. But honestly, this course dives into a much deeper, way more fascinating story. We're talking about the actual biological mechanics of the human face. It's really about uncovering the why behind the structure of a human smile.
And that brings us to the central, honestly kind of dramatic question driving this whole field of study. What actually happens when the growth and development of dentofacial structures just goes wrong? When we talk about this foundational course, we're really looking at the systemic biological failures that can happen right there in the mouth and jaw. It's all about understanding these incredibly intricate growth patterns of the face. And when those patterns deviate, well, it doesn't just mean a tooth is a little crooked. As you're going to see, it can literally trigger a domino effect, leading to major systemic oral health failures.
Section 1. The Medical Mystery.
Now, to solve this mystery, we've got to nail down some clinical terminology first. The absolute key word you need to know here is malocclusion. Malocclusion is that fundamental misalignment dental students are trained to spot right away. It's the core biological problem. This course digs deep into the principles of malocclusion and, absolutely crucially, its clinical implications. So it isn't just some descriptive term, right? It's a real diagnosis of a structural flaw that completely dictates how the upper and lower teeth meet, or, fail to meet.
Moving on to Chapter 3. The Root Cause.
Okay, so the source gives us the exact 5-chapter progression of the course, and it actually tells this brilliant chronological story. First up, students learn craniofacial growth and development. Basically, what's supposed to happen naturally. Then, Chapter 2 covers Orthodontic Diagnosis and Classification, how to categorize the issues. But then, we hit the real turning point. Chapter 3, Etiology of Malocclusion and Dentofacial Deformities. This is the heart of the whole thing. Etiology simply means the cause. This is where that massive why behind the deformities is finally answered. And it's only after they understand the cause that they move on to Chapter 4, Biomechanics, and Chapter 5, the actual appliances. I mean, it makes perfect sense, right? You literally can't fix the machine until you figure out exactly why it broke down in the first place.
Section 3. The Diagnostic Toolkit. And that brings us to the Forensic Evidence Gathering Toolkit used in Orthodontics I. The source outlines 3 really specific methods practitioners use. First is cephalometric analysis. These are super precise radiographic measurements of the head and face that let dentists literally trace a patient's skeletal landmarks. Second, we have clinical photographs, which map out the external and internal facial architecture. And third, dental casts. These are the exact physical replicas of a patient's bite. These aren't just for keeping records in a file, they are the absolutely essential tools used to assess and definitively diagnose the specific type of orthodontic issue a patient is dealing with.
Section 4. The Clinical Stakes.
So the clinical relevance of all this is explicitly tied to addressing both functional and aesthetic concerns. A lot of the time, we kind of conflate orthodontics entirely with aesthetics, just getting that picture-perfect smile. But the source material draws a really bold line here. It shows us that understanding the etiology of malocclusion actually solves vital, functional biological issues. We're talking about achieving better occlusal relationships, which just means how the teeth actually bite and chew together, and improving the overall dental arch form. Aesthetics are great, for sure, but function is survival.
And here is where the stakes get incredibly high. If those functional concerns aren't addressed by getting the teeth into proper alignment, the cascading medical conditions can be really severe. Without that proper alignment, patients face major preventable issues. We're talking about periodontal disease, which attacks the gums and bones supporting the teeth. They're also at a huge risk for temporal mandibular joint, or TMJ disorders, and TMJ can cause this chronic debilitating jaw pain, alongside a whole host of other oral health complications. By mastering the etiology and alignment, a dentist isn't just moving teeth around. They're actively intervening to prevent what could be a lifetime of chronic pain and disease.
Section 5. Mechanics and Effective Care.
Okay, so once a student fully understands craniofacial growth, the etiology of the deformity, and the biomechanics of tooth movement, they finally get to apply the interventions. The course gives some really vital insight into the specific types of orthodontic appliances available. This includes fixed devices, like your traditional braces, and removable devices too. But the really big takeaway from the source is their application in comprehensive treatment planning. Mastering that etiology allows the practitioner to accurately select the exact right tool for the job. It's essentially precision medicine
just applied directly to the mouth.
So what does this all mean? The absolute crucial point is this. The skills and knowledge picked up in orthodontics eye are not just about memorizing hardware. Understanding the root cause, the etiology, is the critical key to comprehensive clinical care. It fully equips future dentists to provide truly effective care for patients who really need intervention. And it all starts with Chapter 3. It starts with etiology. If you don't know the origin of the deformity, you literally can't hope to guide the biomechanics to fix it. Which leaves us with a pretty provocative thought. If our smiles are built on such a delicate balance of functional biomechanics, what subtle, hidden developmental factors are shaping the way you speak, chew, and breathe right now, without you even realizing it? Kind of wild to think about. Keep that in mind the next time you look in the mirror. Thanks for joining me on this explainer, and keep learning.